Hi everyone, it's Nurse Cathy. Today we're going to talk about seasonal depression. Seasonal depression is seasonal affective disorder, and the acronym for it is SAD. And some people think of this as the winter blues. Now, this is a legitimate type of depression, and it's recognized by both mental health professionals and healthcare professionals. Now, SAD's more than just the winter blues. People who have symptoms usually have some mood changes, and it's similar to depression, and the symptoms are overwhelming and sometimes can really affect our daily functioning. Now, seasonal affective disorder, or SAD, generally affects about 500,000 people a year. Women are mostly affected by the disorder. They usually get the symptoms long around, say, age 18 to 30. Now, January and February are the most difficult months for people who experience SAD. Now, I personally start experiencing symptoms long about probably end of August, right about the time school starts. And it's not because I don't enjoy the fall weather or I don't enjoy the fall activities or the fall colors. That's just that I know after that's over with, then we're going to look at those short days, those cold days, those dreary days, and I'm not looking forward to it. Now, with SAD, what are some of the symptoms? Most people will experience feelings of loss of pleasure. They're not interested in doing things that they normally would do. They might have a change in their appetites, and you seem to crave more carbs during this time and can have a weight gain. Now, I always refer to my slump period, my fall 5. And then in the spring, it seems like that fall 5 is gone. Okay, then there's also fatigue and feeling tired and wanting to sleep a little bit more. And some people have like fidgety. They pace, they wring their hands and things like that, just like they don't know what to do with themselves. And then the most severe symptom is the thoughts of death and or suicide. Okay, now what causes SAD, the seasonal affective disorder? Scientists really don't know the exact cause, but there's enough evidence to suggest that it's related to lack of daylight hours. As fall comes, we have less and less daylight hours and more of dark hours. Now, what it does is it affects our circadian rhythms, and our circadian rhythms are the natural internal processes within our body that affects our wake and sleep cycles. Our serotonin levels drop, and when our serotonin levels drop, our melatonin levels go up, and the melatonin is what causes us to be more sluggish and have more sleepiness. Now, there is treatment that's available to treat SAD, and one of those is phototherapy. And phototherapy is the use of an artificial light. And people respond well generally from this. They generally start feeling better with 1 to 2 weeks of therapy. And a therapy session consists of about a 20-minute session in front of this light. Now, natural light is also very important. So for those of you who are working at home, make sure you open up those blinds, have your workspace close to a window so that you can take in all the natural light that you possibly can. Now, if you are prone to developing SAD every fall through spring, you might want to be proactive and start your light therapy as soon as possible when the season begins. Don't wait until those symptoms appear. Now, the other option, if you need a little bit more other than the light therapy, you can talk to your doctor and see if there isn't possibly some type of antidepressant that's available that will help boost your serotonin levels. Now, if you think you do have the symptoms of SAD, you really need to seek the help of a medical professional first before you self-diagnose that it's SAD, because some of the same symptoms that you have with SAD are also like or similar symptoms of other underlying conditions such as hypothyroidism. Now, once you've gotten medical clearance and we know that there's nothing medically affecting you, any underlying causes, then go to a mental health professional, because they can actually diagnose the SAD condition and they can then start you on a treatment plan that's really very effective. Now, if symptoms become very severe and someone's experiencing feelings of death and or suicide, you want to get help immediately. So you're going to want to go to your nearest emergency room. They will initiate contacting the individuals who will treat you and the type of treatment that you'll need. Now, here's a fun fact. Now, December 21st is the winter solstice, and the winter solstice is the shortest day of the year, longest night of the year. And from then on, each day you will gain a few minutes more of daylight. On December 21st, the sun will set at 5:10 p.m. On January 1st, the sun is going to set at 5:18 p.m. So right there, you've gained 8 minutes. So then if you take a 30-day span from December 21st to January 21st, the sun will set at 5:39. So you have gained almost a half hour of daylight back into your life. Now, for those of you who suffer from SAD, that's a huge boost of encouragement. I know for me it is. Well, that's all for me today. I want to remind you that Ashley will be having a holiday cooking event on her segment on Beyond the Table on Monday. Also want to put a little note in there that as of this taping, the Bucks are playing Northwestern for the Big Ten Championship, so go Bucks. And then also I want to remind everybody that I will be out of the office from December 22nd to January 4th, but I please welcome any emails or phone messages that you choose to leave, and I'll respond to them as soon as I get back. So take care, have a great day.